Hello class, welcome back to class. Today is day 2. If you're following the presentation as we gave you in the catalog, you should be you should have read chapter 6 and chapter 7. So chapter 6 and chapter 7 make up day 2. Day 1 was chapter 1. We do not go in numerical order 1, 2, 3, 4. We combine chapters that are similar together. Today is day 2, chapter 6 and chapter 7. Chapter 6, which is the first part of day 2, is infection prevention or infection control. This is a very important topic. If you pay attention to the statistics about infection in the nursing home, in healthcare, generally in the hospitals, you'll find out that it's a huge problem. People go to the hospital for chest pain or stomach problem. They get there and end up getting infection from the hospital. And that's primarily because the caregivers, the nurses, the nursing assistants do not practice infection prevention protocol properly, primarily washing hands. They take care of one resident or one patient. They don't wash their hands properly. Then they transfer the germs and bacteria from that patient or that resident to another resident in another room. So it's very important that we practice proper infection prevention protocol to protect the residents and to protect yourself. So let's start with section 2, as we normally do of every chapter. Sanitation. What does that mean? So we're going to define infection prevention and discuss types of infections in this section here. So sanitation means ways individuals and communities maintain a clean, hygienic condition that prevents disease in a home, in a community, in this case especially in the nursing home. So infection prevention means set of methods used to prevent and control the spread of disease. Microorganism, that's the living thing that is so tiny, so small that can only be seen with a microscope. They're also called microbe. So microbe and microorganism mean the same thing. Infection, what does that mean? Infection is a state that means that pathogens have entered the body. Pathogens meaning microorganisms have entered the body and they are multiplying, meaning they're spreading. Pathogen means microorganisms that are capable of causing infection and disease. Not all microorganisms cause infection. Localized infection and systemic infection. So just like local, localized means an infection that is limited to a specific part of the body. For example, you could have a fingernail infection and it's only around the fingernail, the finger, that particular finger. A systemic infection means that an infection that has spread all over the body, such as HIV. Healthcare associated infection, we discussed earlier, that is the infection that is acquired at the healthcare setting. So an infection associated with healthcare delivery in any setting, such as hospital long-term care or home care. Drainage means that there's a flow of fluid, blood, or pus, or out of a wound or an opening in the body. That's drainage. Infectious disease, any disease caused by the growth of a pathogen in the body. Resistance, the body has its own ability to prevent infection and disease. So when a person has resistance, it means that that person's body has immunity to that particular microorganism. Communicable disease and contagious disease kind of mean the same thing. Any kind of disease or infection that is capable of being transmitted directly or indirectly from one person to another. The non-communicable disease, just the opposite, a disease that is not capable of being spread from person to person. Cross-infection, we talked about when a nurse, gives care to one resident in one room, does not wash their hands properly, then they go to another room and take care of another resident. So that would be an example of a cross-infection, the physical movement or transfer of harmful bacteria from one person, object, or place to another place or to another person. Reinfection is when somebody has been infected before and they got infected again. So it's very important to maintain clean condition to help prevent the spread of infection. Again, a nursing assistant must know the facility infection prevention policies and follow them carefully. This helps protect visitors, residents, and yourself as a healthcare worker. Transmission means the way and means by which a disease is spread. The disease has to spread through a means. How did it get from one person to another person? Well, we'll talk more about that. Medical asepsis means the practice such as hand washing that reduces or remove or control the spread of microorganisms. Clean. A clean condition is a condition in which an object has been or has not been contaminated with pathogens. Contaminated means soiled, unclean, dirty, something that has been used. Dirty, same thing, a condition in which an object has been contaminated with pathogens. Disinfection and sterilization. Please pay attention to these two definitions. Disinfection is a process that destroys most, and that's the key word, most pathogens and other types of microorganisms, but not all pathogens. So the difference with sterilization is a measure used to decrease the spread of pathogens and disease by destroying all microorganisms. So disinfection destroys most, sterilization destroys all. For example, if you look at the container of some of the hand sanitizer or hand wipes, it will say that it destroys 99.9% of all microorganisms. Well, the 0.1% that it doesn't destroy is capable of killing, a whole city. So, sterilization means all microorganisms are destroyed. Disinfection means, most of it are destroyed. Autoclave, in the olden days, they used to heat appliances, boil it to kill, as a way of sterilization to kill the pathogens. Surgical asepsis is the same thing as sterilization, sterile technique. Again, it's a method that makes an area or an object completely free of microorganisms. So remember disinfection and sterilization. So it is very important that nursing assistants wash their hands after touching items, especially in the dirty utility room. Hand washing, very, very important, but we'll talk more about it. Normal flora, it means that microorganisms that normally live in and on the body and do not cause any harm in that healthy person. So all of us have our normal flora. That means I have my germs, you have your germs, I have my microorganisms in me and on me, you have yours too. Yours don't harm you, mine do not harm me. So that's what normal flora means. Incubation period, that's the period when a microorganism have entered a person's body, but the person is not sick yet. So while the microorganism is growing within in the body, from that period to the time when the person start getting sick, maybe they start coughing and sneezing, when the symptoms now start coming out to show that the person is sick. So from the period the person contracted the microorganism up to the time that the person started getting sick, that's incubation period. Vaccine, again, is medicine that is given to produce immunity to a specific disease. Immunity, we said earlier, is resistance to infection by a specific pathogen. A carrier is the person who has come in contact with microorganism. Indirect spread means that it was indirectly. For example, I may sneeze and then touch a door handle, and then you come behind me and touch the door handle, and then you wipe your face or wipe your nose, and then so that's indirect spread. Or I cough into the air, we're in the same space, and you breathe in the same air, so that's indirect spread. Fomite is an object that is contaminated. Body fluids, so body fluids, all the fluids that can come out of the body. Tears, saliva, sputum, urine, feces, semen, vaginal secretion, pus, wound drainage, and vomit. So one fluid that is not in here is tears. So tears is not tears. Sweat. Sweat is not included here. So sweat is not capable of carrying microorganism, but all the rest of the fluids can carry microorganism that can cause infection. We talked about indirect contact or indirect spread. Direct contact and indirect contact. Direct contact, directly touching a person and then transferring what infection one person have to another person. Then indirectly just means indirect, like we talked about earlier. Mucous membrane, that's the thin lining of the body cavity, such as the nose, the mouth, the eyes, the rectum, and the genitals. It's very important that you understand the chain of infection. So the chain of infection starts with an agent, causative agent. In this case, it will be a microorganism. So a microorganism, because that's what causes the infection. So that's chain number one. Chain number two is a reservoir. Reservoir means a person, where the microorganism has now entered that person and now dwell in the person. So now the person is a reservoir for that microorganism while it is spreading. At some point the person will start, then that's the incubation period, then the person will start getting sick. Now, we talk about this chain of infection, which is how infection spreads. So chain number two is a person that has the causative agents, the microorganism. In order for somebody else to catch what this person have, the microorganism has to come out of that person through an exit point. Maybe the mouth, the nose, the rectum, or wound. So the third chain is the portal of exit, where the microorganism came out of the person. Then chain number four means what mode of transfer, how did it get from one person to another person? We know it, let's say it came out, let's say I have a flu, and then I cough. So my mouth will be the portal of exit, and then as I'm coughing, I cough out into the air, and then the mode of transmission will now be by air. So you now breathe the same air through your nose, and then that means the portal of entry, how the microorganism got into you, was through your nose. It came out of me through my mouth when I coughed, and then coughed into the air, which is mode of transmission. then it gets into you through the nose, which is portal of entry. Then chain number 6 says susceptible host. Remember, just because you breathe in what I coughed into the air doesn't necessarily mean that you're going to get sick. Maybe you have immunity, maybe not. But a susceptible host means those people that have weak immunity, that are susceptible to being sick from, the infection that the person just inhaled. So who are those that are susceptible to infection? Well, children, because they have weak immunity, and the elderly, because they also have weak immunity. So remember the chain of infection: causative agent, reservoir, portal of exit, mode of transmission, portal of entry, susceptible host. These are all the areas of portals of exit. And you have portal of entry. We talked about the chain of infection, the 6 links. We talked about the causative agents, reservoir, portal of exit, mode of transmission, portal of entry, and a susceptible host. So how many ways can you think of to break each link in the chain of infection? At every point, at every chain, every section, there are ways to prevent the infection from spreading. So you don't get a question, for example, how many chains do you need to break the chain of infection? How many ways, or how many chain of the 6 chains do you need to break to prevent the spread of infection? Well, the answer is 1 chain. Only 1 link or 1 chain in the chain must be broken to stop the spread of infection. Well, let's go back to that just to clarify. So, a chain, it's a link between 2 or more chains. Well, if you take 1 chain off, there is no chain anymore because there will be no connection. Then that means the spread will not continue. That's what they mean by that. So let's go to why the elderly are at a higher risk of infection. Well, the elderly are at a higher risk because they always go to the hospital frequently. They tend to have catheter. Catheter is a tube that is inserted into the body to drain fluid out or to use to administer medication. So because there's a tube in the body, then the tube is likely to cause infection. Malnutrition is a serious condition. That's when a person does not eat enough food. Again, that's going to make it more likely for somebody to get infection because the body doesn't have enough nutrients to build immunity to fight infection. Dehydration is another issue with the elderly. This is excessive loss of water or not drinking enough water. It's dehydration, which then makes it harder to make them more at risk for infection. So we understand that, the elderly, the lack of thirst and appetite and illness and medication causes them to be more malnourished and dehydrated. So changes in the elderly, and again, why they are more at risk for infection, we explained earlier. They get hospitalized more frequently. They recover from illness longer. Infections are more dangerous. Their skin becomes less elastic, thin, and easily torn, which makes it easier to get infection. They stay in one place, so they have limited mobility. They're not walking around. They have poor circulation. Sometimes they require catheter, and they're malnourished and dehydrated. So using proper infection prevention method helps to protect the residents. CDC stands for Center for Disease Control. It's a federal agency that is based in Atlanta. They're responsible for improving the overall health safety. Whenever there's a communicable or an outbreak of disease, the CDC always take control of how that outbreak is going to be treated and controlled. Standard precaution, remember this is very important. Standard precaution means that a method of infection prevention in which all blood, body fluids, everything. In other words, you're treating a person as if they were infected. I mean, you're not discriminating, but you're protecting yourself by assuming that potentially, because you don't know, I might look very healthy, and you might not know, you don't know what I have or don't have. So you have to protect yourself by assuming that everyone could potentially be infected. So put on gloves, wash your hands. So standard precaution again means, treat blood, fluid as if they were infected. Wash your hands before putting on gloves, and after removing gloves, wear gloves, as much as possible, and so on. So we talked about that already. Standard precaution must be used with every resident, no matter what. So additional guidelines for preventing infection, clean cuts or break immediately. Cover your mouth when coughing. Stay as healthy as possible. Never use residents' personal item. Never transfer personal items or equipment from room to room. Always hold equipment away from your body. Do not use objects that have been dropped on the floor. Clean all equipment after use. Clean common areas. Remove food and utensils from the residence room. Change and date water cups often. Clean toothbrushes and shaving equipment. Never place contaminated items on the overbed table. When cleaning, moving, always move from cleanest area to the dirtiest area. This next slide talks about proper etiquette when coughing. Cover the nose and mouth with tissue when coughing. Promptly dispose of the tissue in the nearest no-touch waste basket. And cleaning hands after coughing by washing them. Wearing special masks when possible. Encouraging coughing persons to sit at least 3 feet from others in the common area. So let's talk about hand hygiene. Washing hands with either plain or antiseptic soap and water and using alcohol. And hand rub, alcohol containing like alcohol, hand sanitizer that reduces the number of microorganisms in the hand. Antimicrobial is just any agent, whether it's hand sanitizer or wipes, that destroys or resists pathogens. A nursing assistant must know and follow his facilities policy on alcohol-based hand rubs. The best thing to do is to wash your hands. In between, tasks, you can use hand sanitizer, but follow your facility protocol. When should you wash your hands? You're going to wash your hands 1,000,000 times a day. I'm just exaggerating, but you're going to wash your hands very frequently. When you arrive at work, whenever your hands are soiled, before, between, and after all contact with residents, before putting on gloves and after removing gloves, before and after touching meals, before and after feeding residents, before entering a clean room, before getting clean linen, before leaving a dirty supply room, before and after eating, after contact with blood, after handling contaminated items with all objects, after touching garbage, after cleaning spills, after using the toilet especially, after coughing, sneezing, after smoking, after touching, after touching jewelry, after handling animals or pets, before leaving work, and after arriving at home, before touching anything or anyone. So hand washing, very, very important. Wash your hands very frequently. Washing hands. Hand washing is the single most important thing a nursing assistant can do to prevent the spread of disease. This is a quiz question here, so pay attention. There's what we call PPE, personal protective equipment. So what do they mean? These are equipment that helps protect workers, healthcare workers, from serious workplace injuries or illnesses resulting from contact with workplace hazard. So PPE will mean like a goggle, a mask, a gown, things like that. But we'll talk more about it. Don and doff. Don is to put on something like a glove or a gown. Doff is to remove it. Perineal care means care for the private area. Non-contact skin and contact skin. Non-contact skin just means that, sorry, non-intact skin. Non-intact. Intact means there's no cut. Non-intact means there's a cut. There's an opening on the skin. So we talked about PPE, personal protective equipment. They mean gloves, gowns, masks, goggles, and face shield. So you have to know when to wear, each item or all the items, depending on the situation there. So remember that gloves must be changed again if they are wet, they are torn, they are soiled before contact with mucous membrane or any broken skin. So nursing assistant must not leave a resident's room with their gloves on. You will not believe how many times nursing assistants, even nurses sometimes walk out of the room to go get something with the gloves on. Well, you've taken all the microorganisms from that room and spread them in the hallway, and that is not, that does not help at all. This is putting on gloves, and we're going to skip through that. So this section here describes the use of personal protective equipment. We've already talked about that already, so we're going to skip through as well. Again, the importance of PPE in the facility. So, by the way, we during the GNA exam, there is one of the skills is putting on a gown. But you will get to practice all the skills. So think about this question: why are there specific disposal containers for linens, trash, equipment, and infectious products? Because we don't want to mix. For example, you cannot put gowns that are infected from an infected person into the general linen basket. So it has to go in a red bag in isolation, a different isolation container. So we talked about these already. In the healthcare facilities, spills are a threat to safety. So this section is talking about spills. When there's a spill, you see water on the floor, don't walk over it. No matter how small, somebody might slip and fall. A resident might slip and fall. So you have to get something and take care of the spill. Don't go say, well, that's housekeeping job. Let me go look for a housekeeping person. Put on gloves. If you need to put a blanket over it, put a wet floor sign, put something. If it's too large for you to handle, just put something over it and go get the right person to take care of it. So we talked about infection prevention, again, transmission. Let's go back a little bit. There are three categories of transmission-based precautions. So you have airborne precaution, droplet precaution, and contact precaution. Airborne precaution, again, prevents the spread of pathogen that travel through the air. So if you look at this picture here, airborne precaution, again, talks about, pathogens that travel through the air after being expelled. So even breathing, or coughing. Then we have droplets precaution. These are used for disease that are spread by droplets in the air. So droplets normally do not travel further than 6 feet, so remember that. So this is an example of droplet precaution. Then contact precaution. This is used when a resident may spread an infection just by direct contact, by touching them. So this will be an example where they're bleeding and they have an infection, and then you go directly touch them, and then you contact what they have. So it's very important to remember to use transmission-based precaution in addition to standard precaution. So the reason why we were talking about those different transmission-based precaution, airborne, droplets, and contacts. So if someone has a communicable disease, say in the nursing home, they're going to be placed on isolation. So the type of isolation will depend on the type of infection they have. So again, residents who require transmission-based precaution are referred to as being on or being in isolation. They're going to be in a room. There will be a sign on the door that says airborne stop, airborne precaution, or contact precaution. There will be a bag on the door, a large bag on the door that have equipment like your gown, your goggle, your gloves, your mask, so that before you go into the room, you dress up and cover yourself and protect yourself before going into the room. And then, in the room there will be a separate basket for the gown. It doesn't go in the regular trash can. So we'll talk more about that. So these are the same isolation equipment, isolation protocol that I just talked about. So we're going to proceed here. So one thing about isolation is that so the resident is put into the room. They cannot come out until they are cleared by the doctor. So one most important thing to make sure is that when you go in there, don't treat them as if they have Ebola. Because sometimes you might have to feed them if they're a feeder. But go in there and talk to them, give them some attention. Don't make them feel like they're isolated or disconnected from the outside world. Okay. Bloodborne pathogen. The microorganisms found in the human body that can cause infection. OSHA, Occupational Safety and Health Administration. It's a federal agency that makes and enforces rules to protect workers from hazards on the job. Bloodborne pathogen standard. It's a federal law that requires healthcare facilities to protect their employees from bloodborne health hazards. Exposure control plan and exposure incident. Let me start with the incident. So, exposure incident means that a staff has been exposed. Maybe they got stuck with a needle that was already used by a nurse to give an injection. But you don't know whether the resident have HIV or not. So there has to be an exposure control plan. What is the facility plan regarding when somebody is exposed? There has to be a step-by-step protocol to follow. So in my facility, there's a sink that has flush water, where the first thing to do is to go there immediately, turn that water on, and flush the area. And of course, it has to be reported to the supervisor, and the person will need to go to the emergency room to be checked out, and so on. So bloodborne pathogens are microorganisms found in the human blood. Okay. So by law, employers must follow these rules to reduce the risk of acquiring infectious disease. Again, all the rules made by OSHA in terms of bloodborne pathogen standard. So again, we talk about after an exposure, specific steps must be taken. So I've already discussed that. There are two major bloodborne diseases in the United States that are, concern healthcare workers. One is HIV, and the other one is hepatitis. So HIV, just a quick summary. This is the human immunodeficiency virus and acquired immune deficiency syndrome. Again, AIDS is caused by HIV, and HIV damages the immune system over time. The stage of the disease when tumors and central nervous systems can appears is known as AIDS. People with AIDS can die from the illness. HIV is transmitted by blood, infected needles, from mother to fetus, or by sexual contact. Then we have hepatitis. This is the inflammation of the liver, caused by certain viruses and other factors, such as alcohol abuse, some medications, and trauma. There are different types of hepatitis. Hepatitis A, B, C, D, and E. But the hepatitis B is the serious one to be concerned about as a healthcare worker. So again, you have to take precaution while on the job to avoid any incident. Use proper personal protective equipment, handle needles and other sharps with care. C. diff is a bacteria that spreads in the feces, in bowel movement. So you have to be careful. Again, if somebody has C. diff, they'll be on isolation, and that will be a contact isolation. That's the end of chapter 6, which is part of day 2A. And next we will talk about, go to chapter 7, which is day 2B. Thank you.